We're going to talk about above the muscle or subglandular breast augmentation versus below the muscle or subpectoral breast augmentation. In the United States and in my practice, probably 95% of the patients have a subpectoral or below the muscle augmentation. There are some people though that are a good candidate for an above the muscle approach. Typically the patient who wants an above the muscle implant is someone who's very fitness oriented. They're a bodybuilder. They don't want what we call an animation deformity, which is showing the breast implant flexing when you move when it's below the muscle. For most patients, this is not a problem, even if you're a heavy-duty workout person. But there are some people who just have been online and they don't want it. So we can go above the muscle. The key elements are you have to have enough soft tissue to cover the implant, because if you don't, you're going to see the edges and you're going to see rippling and wrinkling. It's really a fallacy for some women who come in and say, read online that I might not need a breast lift if you just put the implant above my muscle. I think that's a fallacy. I don't think that's a real procedure. And I think it really is doing something inappropriate for the patient, because as soon as you load that soft tissue with an implant, which is more weight, it's just going to stretch that skin and it's going to what we call bottom out, or you're going to have a very bottom heavy breast. It's going to be a poor shape. And we know factually that whether it's subglandular, or now some people try to say you can put an implant subfascial, really, really hard to do, not a very good operation. And it still has the same problems for many patients, that much, much, much higher rate of capsule contracture. And if you have a really hard, painful, misshapen breast, you're going to need a revision. And I always tell people you'd rather do it right the first time than to have to come back and try to fix something a second, a third, or fourth time.